Hello and welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Chamber of Commerce. We're here at the beautiful Mercy Hospital, one of the most beautiful facilities that we have in Miami as a hospital. It's prime real estate, and it's so beautiful. So I imagine working here must be a dream. And with me is Dr., I'm going to say it in Portuguese, Jose Osorio. Did I say Jose correct?
Perfectly.
Jose Osorio, who's a market director for the HCA Healthcare Systems of Miami, in Miami, right? I said it correctly. And we had the honor to have you as a panelist at our health symposium about a month ago, talking about heart rhythm, palpitations. And as I was discussing earlier with you, my mom had a lot of that. It was due to lung disease. But I did visit an electrophysiologist many times, so I'm aware of how uncomfortable that could be. And if it's heart related, it must be even worse because you know it's the heart. So tell me a little bit about you, where you studied, your career, and how you're doing here and all the new things you're implementing as the market leader.
Thank you, Lily. It's a pleasure to be talking to you and your audience. So I'm originally from Brazil, as you've said, and I did my medical school there. In 2002, I actually moved to Miami, where I did my training in internal medicine at Jackson Memorial. I then moved to Alabama, where I continued my training through electrophysiology, which is the study of heart rhythm problems. Stayed there for almost 15 years, but I always wanted to come back to Miami. I think as a Latin person, exactly, as a Latin person, me and my family, my wife and kids really wanted that chance. So we were very pleased that last year we started these conversations with HCA, and I think it's a unique opportunity for me and my family to be back here, but also to work hard to build something unique here to take outstanding care of our patients in this market.
And what is a day, a regular day for you?
So right now we're working a lot on building, I think, the foundation of what the patient care model we want and the vision we have will ultimately be. So in a traditional day, right before I moved here, typically I'll do 1 or 2 days of clinic a week, and then we have several procedural days. Now I've spent a lot of time here meeting with physicians, meeting with administrators, with insurance administrators as well, managed care, so that we build a program that is centered around quality, value for the patients, payers, hospitals, and really focusing on a patient-centered program. I think that's the model for success. You think about the patient first, you'll design a program that you would be proud to have your parents cared for at that program, and that's what I envision for here.
And you designed something, right? And that's the society. What is it? The Electrophysiology Society. So embraced it. So tell me about that, because I'm not a doctor. I studied political science, and I read so much about you, and it's so nice, but it is difficult to comprehend. So we want to put it very simple for our viewers.
Absolutely. So
what you designed and why that design was embraced by the Rhythm Society.
Yes, I spent the past 8 years at a hospital in Alabama called Grandview. The model we created there, which is what we are building here, was a model focused on patient outcomes, improving patient outcomes, putting a lot of focus on quality improvement, standardization of care, so creating protocols and using evidence-based, guideline-based care, partnering with insurance plans and payers to decrease cost as well, and did this in a really team-based approach. So nurses, technicians, the anesthesiologists, the quality committee. So the model was very successful. There are about 2,000 electrophysiologists in the U.S. About 500 actually visited me to spend a day with me to understand what was our model, how we built it, and why was it successful. So through that, the Heart Rhythm Society, which is the Society of Electrophysiology, spent a week with us, did a series of CME, continuing education videos, trying to educate others on how to start that journey of quality improvement, so to speak, and have it become just an integral part of what you do. So I think it's imperative that we not only standardize care so that every patient has the same possibility to have the same level of care with quality. And we also want to collect outcomes. You want to know as a patient, what are the chances of success of a procedure, complications of a procedure. So I think it starts there. It starts with measuring everything we do at the hospital, being very transparent about this, understanding the areas for improvement, and perhaps the most important part is that it can't be centered around the physician. It has to be centered around the patient, and you build a team that believes in that mission and practices that way.
And what does the Heart Rhythm Society then do? Because I didn't know, prior to reading about you and all your many achievements, I didn't even know that existed, and probably our viewers don't even know. So how was that started, the Heart Rhythm
The Heart Rhythm Society is the largest society in the world for electrophysiology. So it has kind of two missions. One is to organize and help physicians have educational opportunities and opportunities to facilitate their quality improvement journey, but also has a very important component of direct patient education. So a lot of community events, such as recent ones we may have seen out of the hospital, CPR and AEDs. The Heart Rhythm Society is an important society that pushes that forward throughout the country. So it was quite an honor for me.
It is. That's what I was going to say. It's an honor
partner with them.
To partner with them and for them to acknowledge your efforts and what you have done, and speak so highly of you as a doctor, because everybody wants to shine in their own respective career, and medical care is so critical, very important, and the heart is what makes us live. So congratulations to you.
Thank you.
I was very impressed when I read about that, and I was so happy when we had you as a panelist, and you spoke so well, and everybody was so happy and engaging. And it's things that we need to do to teach and have our business community know about different areas of medicine. And these are things that we didn't know. I don't know. I consider myself that I study political science. I have nothing to do with science, but I like it because I think it is so important to know about science and all the things and the advancements in science. And I read about you, and I was very, very much impressed.
I'm
very much.
So helpful. It's so helpful what you're doing. I'm so thankful for this, because atrial fibrillation is a condition that the number of patients is exploding in the United States.
That's what I've heard, yes.
Because of a few factors. One is the aging population, so it is a condition more prevalent in the elderly, because of obesity, because of high blood pressure, sleep apnea, and so
lack of exercise.
Lack of exercise, alcohol use. But the number of patients with atrial fibrillation is growing so fast, and educating the community about this condition that can cause strokes, can decrease your quality of life, is very important. Today we also have the wearables. Apple Watch, for example, is diagnosing a lot of patients with atrial fibrillation. So a lot of patients, they'll come to me after their Apple Watch told them, you may have atrial fibrillation. So that's another reason why we're diagnosing so many patients. But that ability to treat patients earlier on, before they have a stroke, before they're admitted to the hospital, is key. And I think programs like what you do, educating the community, it's the only way we'll ever,
well, thank you
fulfill
for that.
mission.
And my last question, do cardiologists refer then patients to you? Or would someone with, say, any palpitations or anything that they feel, bradycardia, or would they come to you directly? Or is it both? Cardiologists refer them to you, or they come to you directly?
Good question. I think it's a little of both. Sometimes primary care physicians will diagnose AFib and send directly to me. Sometimes a cardiologist will see the patient with a palpitation and refer to us. And sometimes patients that have diagnosed themselves will contact us directly. What is important is the initial treatment for atrial fibrillation, which is decreasing strokes by giving you oral anticoagulations or considering procedures. That can be done by a primary care physician or a cardiologist. But then when we start considering more advanced therapies, such as a procedure to treat and sometimes cure AFib called ablation, that's when we really need to be a part of that discussion, right? Ablation is a procedure that we perform frequently, commonly here at Mercy, Kendall, and Aventura hospitals from HCA. And it is a procedure that, again, particularly if done earlier in the disease process, the sooner you are diagnosed, before you have complications from the condition, has very high chances of helping you control or be cured from that condition. So I think because of that, nurses, primary care physicians, cardiologists, and electrophysiologists, we are all today involved in the treatment of atrial fibrillation. It's so prevalent. You go to the hospital, a lot of patients
It's
have
good to
an
know
AFib.
that we're informing the community about that, because I didn't know.
Absolutely.
Right. So, did I leave anything out? Because this is a business minute, but it's usually 5 or 6 minutes. Did I leave anything out?
No, I think
We have to
this
do
is
another show then.
great all
continue.
around. So yeah, to be
To continue
continued.
that conversation, because this was so interesting, and we enjoy at the South Florida Hispanic Chamber of Commerce doing 4 events a year that deal with health. We do the heart disease, the breast cancer awareness, health symposium, and we do a sustainability lunch, which is coming up. But how health is affected by all of this changes, right, in the atmosphere and pollution and the plastic in the system, and it's just bad. So at least we try to help our members and teach them with panelists like yourself to talk about what's going on.
So I'd like to thank you for giving me the chance to participate in one of your events and have a chance to speak to your audience about atrial fibrillation and our new program at HCA Miami.
Absolutely.
Happy to continue this conversation
Yes,
at another time.
absolutely, because we have to inform the community more and more about this topic. Is it atrial fibrillation?
Yes.
I got stuck here. But anyway, everybody who knows me knows I get stuck sometimes with words. But I really want to thank you so much, Dr. Osorio. João, right? José. And I love Portuguese, and I'm actually trying to do a little bit of Portuguese to learn a little bit more. We'll do it in Portuguese next time for sure. And I really enjoyed having a conversation with you, visiting Mercy. This is one of the best hospitals here in Miami-Dade County, and I thank you so much for your very valuable time. And we'll see you all next week at the same time. And thank you for tuning in to another episode of A Business Minute with Lily Lopez.